Whether the patient is here at Baybrook or whether the patient is in his or her home or they're in assisted living, if the patient has a life-threatening event, they need to go to the hospital. you know? So if the patient is here at Baybrook, right, you have clinicians, rehab professionals, 7 days a week there's a physician in here. They're not in here 24/7. So, so we're going to try to treat, we're going to take steps to triage the issue here. What we know is that multiple moves, multiple patient transfers, if they can be avoided, are actually better for the patient, right? So we're going to try to manage whatever the issue is here. If we can't, the patient's going to the hospital. We can provide a high level of clinical care and service here, physician directed, but ultimately there are emergency services, ER type, capabilities, equipment, et cetera, that we simply don't have. So if a patient needs to go to the hospital, we're going to make sure they get to the hospital. So that's when they're inpatient. Once the patient gets home, and if they're still in a risk period, so like with an ACO, with a bundle payment for care improvement type of a patient or a program, with an episodic payment model, which would be either a 30, 60, or 90-day risk period, you still have a patient in a risk period. Same calculus applies though with regard to need. If that patient is experiencing a life-threatening event, get them to the hospital. 911, get an ambulance, get them into the ER. What we found over many years of experience with accountable care organizations, we were an awardee convener in the bundle payment for care improvement program. We're engaged in other episodic payment models. What we have found is that often patient gets home, patient thinks he or she is having an event that ought to get them to the hospital, but there are better ways to triage that event. So here are some of the options for triaging an event when a patient gets home. One is call center. They can call into if they're in our call center program, they can call the call center. It's paramedic staffed. Paramedic has their patient records and can literally walk them through a triage of what we have found is frequently it's medications confusion. I've got 6 meds I'm supposed to take. I take 3 in the morning, 1 midday, 2 more in the afternoon. It's 10:30. I can't remember which med I'm supposed to take. And so the paramedic has all those records and can walk the patient through that issue. Other more cost-effective means for addressing a patient's needs who either he or she or a family member thinks they should go to the hospital, we can do in-home physician visits, we can do in-home nurse visits, and we can do in-home paramedic visits. Paramedics operate under the direction of a doctor. They can administer fluids, they can administer meds. Furthermore, when a patient readmits to the hospital unnecessarily, that patient has just gone to the highest cost destination in our healthcare environment. And if they need it, they ought to be there. But if we can, for instance, if we can bring that patient back to Baybrook, great clinical setting, physician staff, nurse staff, and we can address their needs here, we've gotten the right clinical outcome for the patient at a significantly lower cost. And that's where we want to be. That's where accountable care organizations are asking us to be, and that's where CMS is asking us to be via programs like the bundle payment for care improvement program. When it's your family member, right? The panic, the emotion thing, and so we get it. And folks, decisions are made, and that's fine. Once if a patient readmits to the hospital that shouldn't have, well, we're going to treat them in the hospital.
Yeah.
We're going to get them back on track. But to the degree that family members, community support structures, individual patients can understand that if you have your wits about you and can understand that perhaps you don't need to dial 911 and you can get immediate care by calling into our call center or by calling back to Baybrook and getting a clinician on the line, ultimately that's good for the overall healthcare system in terms of optimizing cost and care. Ultimately, if the patient really doesn't need acute care, it's better for the patient. You don't want to be in the hospital if you don't have to be in the hospital. So to the degree that you can manage that, whatever that issue is, without going back into the big box hospital, ultimately it's better for you as a patient.